Today I have Brianna here. Welcome to the podcast, Brianna. Tell us a little bit about yourself and what drew you into women's mental health.
Hi, everyone. I'm so glad to be here. I'm Brianna Powell, and I own Bloom Mental Health and Wellness here in Sioux Falls, South Dakota. I am a psychiatric mental health nurse practitioner. It's kind of a mouthful. Basically, that means I'm a nurse practitioner who can provide therapy, mental health medications, or other healing modalities. And I'm also a nurse midwife. Although I'm not still attending births or doing prenatal care, I still feel like I bring that midwife with me to every visit. Lately, I've been calling myself a mental health midwife because midwife means with women. So my main goal being a mental health provider that specializes in women's mental health care is that I'm really with the people I'm serving. I'm listening, I'm supporting, giving my full effort to helping them heal and to feel their best. So I kind of mentioned I only see women, so I'm very specialized in women's mental health care. I have a certification in perinatal mental health, which basically means providing mental health care throughout pregnancy, postpartum. I have a deep passion for pregnancy loss and supporting moms and families through that, as well as infertility. But also, I'll see women, ages 18 to 65, but I have my little niche areas inside of that. So, what drew me to this area is that I really just saw the need for better healthcare for women. We are juggling so much, and I wasn't seeing that need being met by our current healthcare systems. It started while I was working as a nurse midwife for a hospital system. I really saw that lack of, specialized supportive care for women, and that their needs weren't being met. So, and at the time too, I provided, mental health medications for my patients at times, but I really only had that basic knowledge around them, and I found that I wasn't really fully meeting their needs, and I wanted to be able to do that. And I can like vividly recall several instances where I had patients in my office while I was a midwife, and they were really struggling with their mental health, and it just seemed to be beyond my ability to help them. I'd already done kind of the basic things and then wanted to refer them to psychiatry, and it was going to take months for them to get in when I knew like they needed to be seen, within the next day or two, and it was just heartbreaking. So at that point, I decided to my own additional training in mental health while I was a midwife and found that I just loved learning about it. I loved helping patients through their mental health journey. And so I definitely developed a passion for it. And then I heard what a mental health nurse practitioner was. I really had no idea before that. And I just knew like this is what I'm supposed to be doing. And I knew I wanted to start my own practice so I could really do things the way I think they should be and tailor the care to my clients. Yeah, and then also one other thing what drew me to this space too is that many mental health providers who prescribe medications are often not comfortable prescribing it to pregnant patients or breastfeeding moms. And then oftentimes, if we're not comfortable or we don't have that education, they'll just tell them, like, you just need to stop all your meds, get off the meds because they, aren't sure. And
Mhm.
then that can lead to a domino effect for the patient and her family. And I've unfortunately seen some of those situations. So I really wanted to take it upon myself to get all of the knowledge, the education to stay up on the latest evidence-based research regarding that and to really be a resource for my patients of like, you do have options. There are medications that you can use while you're pregnant and breastfeeding, and we probably don't need to switch all your meds now that you're pregnant.
Yeah. And also, it's switching meds is uncomfortable. And then you're dealing with anxiety and depression and a pregnant body or a new baby on top of it. And it's just like such an incredibly uncomfortable time. So having like someone like you who is very well educated on what's okay, what's not okay, because women always want to do best for their baby and they'll always sacrifice themselves in the process. But sometimes it's like, you don't have to. You can feel good throughout this. And also just having
Mhm.
somebody to tell them, like, you are safe, your baby's safe to do this is such a peace of mind for moms.
For sure. And then one thing I always highlight with patients, we talk about the risk of the medication, of course, right? But also we need to talk about the risk of untreated mental health or undertreated mental health. There is so much research coming out about the effects on the child long term, actually, of like more behavioral outbursts, less IQ with untreated maternal mental health. So actually, and there's more like preterm birth, diabetes, all of those things with not treating mental health for mom. We could go on and on, but there's more to the picture of like actually you could really be helping your child by taking this medication potentially.
Yeah. Yeah. That's so good to hear. So for women listening today, and they maybe have this kind of vague feeling of like something is off, maybe don't have words for it, maybe just don't feel like themselves, what are some important signs that they may need to, or they may want to pay more attention, seek some sort of help? Like what would you say those things are?
Yeah, so I would say, first listening to your intuition of like, hey, I just don't feel right. Like something's off. I don't know quite what, but I'm not feeling like myself. Or you might have, close friends or family, notice changes as well. So kind of taking that into account. But I'll go through some general things that I would say are signs that you might need to seek some help. One is noticing changes in your sleep. That's a big one. So if you're struggling to fall asleep, you're waking up multiple times throughout the night for no reason, or waking up very early for no reason, or it could be the opposite where you're just sleeping way more than usual and still feeling really tired. If and going along with that, feeling exhausted all the time is definitely a sign, especially if you are getting a good night's sleep. Trouble concentrating, and noticing changes in your appetite. So it can be either like you're eating more than usual or you're eating less. You just don't have that usual appetite that you have. Another sign is just feeling like really restless, like you got to move, you can't sit still. Or it could be the opposite, like you're moving way slower than normal. Like people comment maybe that you're just really sluggish. And then of course, like what's going on in your mind? Are you noticing more of that negative self-talk, like saying, I'm not a good mom, I'm not doing this or that good enough, I'm a failure? That would definitely be a sign. If you're feeling like you're not looking forward to things, you don't have that hope for the future that you usually do, that would
Mhm.
be definitely a warning sign. And then, of course, we think of the typical sign like, I just feel down, I'm feeling sad, and that's happening for most days. If it's just
Okay.
here and there, I would say that's pretty normal. We're human, we have ups and downs. But if it's feeling like every day is really heavy and sad, I would say that's a warning sign. One that comes to anxiety is just you're worrying all day throughout the day and you really just can't stop it. It just keeps snowballing and going on and on in your head. And kind of just feeling like something terrible could happen. You don't know what, but something bad is going to happen. And a lot of times you can feel that physically in your body as well. You might have things like chest pain, feeling like your heart's racing, trouble breathing, numbness and tingling, like even GI symptoms like just feeling nauseous or having stomach pain, that can be anxiety, as well as muscle tension. And then if you're noticing you're not doing the things that you usually enjoy doing, that would be a big sign, or just isolating from others when you're usually a very like social person. That would be another thing to look for.
Okay, good to know. So for somebody like that is noticing some of those symptoms and they are thinking, what do I actually need to do, or what would help actually even look like? What would you say to somebody wondering that? Because sometimes too, it's like the unknown. And like, I'm going to schedule an appointment, but then what happens after that, and what does help actually look like?
Yeah, I think it's all about finding the right fit for you, like the right person to help you through the process. So, you know, the first step is finding someone, which I feel like is the hardest step for clients is just to get in the door to either a therapist or a psychiatrist or someone like me, just showing up, and taking that big step of asking for help. So you can look, you can ask for recommendations if you have friends you feel comfortable talking about this with. Some of us don't feel comfortable doing that. My other suggestion is looking on Psychology Today. You can filter by your location, different provider preferences, and it will give you a lot of profiles with information about them, pictures, videos. And I would say choosing someone that you feel comfortable with is the most important thing. And then on that same note, if you meet with someone and you're like, this is just not a good fit,
Mhm.
knowing that's okay to change because if you don't feel comfortable, it's not going to give you what you need. So I
Yeah.
would say just reaching out is the biggest step. And then from there, you have your first visit where usually we go through a lot of history, what kind of symptoms you've been having, have you tried meds in the past? What have you done? And then come up with, here's a plan moving forward together. Here are, some of the good and bad things about this potential plan and, not letting, but encouraging the client to decide what they feel is best for them. And then like, how often do you want to meet from there? It's usually pretty individualized for what everyone needs.
Yeah. Okay, good. So many of the listeners of the podcast are going to be like perimenopausal age, so late 30s up to their 50s, and they're navigating hormonal shifts and some identity shifts, carrying a lot of burnout and stress. And what are the most common mental health struggles that you often see for women in this stage of their life?
I would say anxiety is definitely the most common thing that I see, worrying a lot about different things. Women have a lot going on. We are juggling multiple demands, possibly, having children and caring for our own parents' needs. You're kind of in that sandwich generation. And then there's that high mental load that moms particularly can have with caring for the family and all the needs. But going along with anxiety, I see mood changes, potentially some depression, also PTSD. We do know that most women experience some sort of trauma in their lifetime, but that doesn't mean you will go on to experience PTSD, but there is a high likelihood that that can develop. And then I see women with ADHD as well. I see some women who have had it their whole life, but just never been diagnosed or treated. And then we catch it kind of later in life. And, they are amazed by how much better they feel when that's treated. Other things that I think are going on during this time of life that contribute to mental health is just there might be high demands at work if you're working outside the home, career changes, financial concerns, especially with like the increased cost of living. And if you have kids and childcare, you could still be in your childbearing years, if you're in the phase, so having babies, and then maybe you have some older children as well. So just kind of juggling all of that is a big thing.
Yeah. I definitely going back to like PTSD and having trauma at some point in your life. Why do you think those symptoms start? Like, do you see a pattern of symptoms starting like women get into their 40s and then that PTSD starts to emerge? Like, do you see that pattern, or do you feel like it's just like whenever their bodies start to let them know that it's ready to be worked on?
Yeah, I feel like usually for if it's PTSD, you have this trauma that occurred, and the symptoms are going to typically develop, soon after. But what I see is a lot of women, we will kind of repress those
Mhm.
feelings and push them down, and they're not there, and we're just going to ignore it. And then, it might come out later, in a more severe kind of way or as physical symptoms or medical conditions, autoimmune conditions. It comes out in some sort of way at some point, usually. So,
Yeah. Okay, good to know. I also I tend to notice that women start to get diagnosed with ADHD too, like at this point in their life. And I think it's just because it's more talked about now.
mhm.
And, it wasn't like when I was growing up, it was like ADHD was just a boys thing. Like there were like the naughty boys in school that had it, and nobody else would ever be considered to have it. But like women's symptoms are so much
Mhm.
different than those naughty boys in grade school that I remember. And then it just like clicks for people that they're like, oh, this is why these things are so hard for me. And now I feel so much better and I can actually like follow through and do those things. Cause honestly, like I get a lot of clients that probably are more have ADHD tendencies because they're just like can't seem to like do the thing that they need to do and they just feel so stuck. And sometimes they're like, well, I just have a motivation problem or I just have a discipline problem. And it's like, no, there's something deeper going on here. I don't think it's that you don't want to or you're not interested in, but there's a block here and there's a reason. And I think you need to go a little bit deeper on this.
I've actually had a lot of clients lately who said that their child was diagnosed with ADHD, and through that happening and them learning about ADHD and the different symptoms, they're like, "Oh, like this is what I think I have." And
Yeah.
so that's kind of how they learn about it. And it can make such a big difference to be treated for their ADHD, but also to say that oftentimes when you have ADHD, it can look like anxiety or it can look like depression. So it can be hard to get the right diagnosis.
Yeah, yeah, for sure. So, how do you see that hormonal changes, especially like you meet with women when they go through a huge hormonal shift during pregnancy and childbirth, and then also perimenopause in there, we have a lot of shifts. How do those shifts get maybe misdiagnosed as a mental health or like the opposite? How do you see that mental health is diagnosed as just a hormone thing or, vice versa?
Yeah. Well, we definitely know that, hormone fluctuations during those times like menopause, perimenopause, pregnancy, postpartum, they can lead to like mental health changes for sure. And also some women are just more sensitive to those hormonal fluctuations. They've found genetic links actually that show that. So it's not just like, oh, I'm, not tough enough and I'm having these sensitivities. It's just your genetics are different to where you might be more sensitive to those changes. So one of the reasons we see that is that decrease in estrogen and progesterone levels that happen during menopause, they lead to a decrease in our serotonin levels, which is our feel-good hormone. It helps to prevent anxiety and depression. So when we have the dips of the estrogen, we can see more anxious symptoms, low mood. They've shown like trouble concentrating, fatigue, just feeling like your brain is moving a little slower. They've actually done like functional MRIs that look at, brain changes and movements during perimenopause. And they show that the areas that we use for like emotion and cognition are less active during perimenopause and menopause with that decrease in progesterone and estrogen. So I always tell people, perimenopause, it can start in your 30s for some women. So it might be earlier than people would expect. And the average age for menopause is actually around 51. So some of us aren't quite aware, like, hey, it can happen a little earlier than anticipated. And I tell clients too that, it may be a benefit to try hormone replacement if their anxiety or mood symptoms are kind of occurring around that same time as perimenopause or menopause, and especially if maybe they didn't have these symptoms before, or maybe the symptoms are just worse now. They could benefit from some hormone replacement on its own or with mental health medications. They can definitely work better together.
That
And
was going to
then,
be my next question is how do you know? Like, if
yeah.
someone is like, I think I'm perimenopausal or maybe I am menopausal and I'm feeling these things, like how do I know if I should do HRT or if I would just feel better with anxiety meds or something like that? And my guess is that it's just you just got to try one
I was gonna say,
there.
sometimes it's a little trial and error. Right now, I don't prescribe, HRT. I may in the future, but I think options are, let's look at your symptoms and see kind of the history. What does the picture look like? We can try a mental health med first if you want, or I have a lot of great referrals for HRT to have an evaluation for that potentially.
Okay, good to know. And then how about those that are wondering or considering using medication, but there's this stigma attached to it and their resistance, and they feel like they're depending on something to make themselves feel better, or they just have confusion about this. How do you help your clients decide whether medications are right, or maybe it's HRT, some lifestyle modifications or more talk therapy, or like how do you decide or how do you help them decide what would be best for you and like feeling safe to take the step towards what would be best for them?
Yeah, I think it involves really, providing education on all of their options and making it not quite as scary if, maybe they've tried all of the other things and, we've done the therapy, we've done the exercise, the supplements, all the things. I would say most of the time, by the time someone is coming to see me, they've kind of tried all of that for the majority. And so
Mhm.
they're like, I just need, something to help me feel better. A lot of it is just like, okay, this isn't as scary as it kind of is made out to be. Like, as far as side effects or risks to you are pretty low, but I would go through that with them. And then knowing, like, if you start a medication and you don't like it, right? You're not married to it. We can stop it. No problem there at all. So it's more of like, let's find what works for you. So if this doesn't work, let's go back to the drawing board and maybe we can try a different medication if you're interested in that, and you can have a totally different experience. There is so much difference from medication to medication, and we're so unique in the way meds affect us. I wish there was some chart that was like, do this med, it's going to work for this patient, but that's
Yeah.
not how it works, unfortunately. So just knowing that, even if you've tried meds in the past and they didn't work for you, that doesn't mean that no medication will work. I've had so many patients where they're like, I've tried all the meds, everything, and we do something a little different, and it's night and day, feeling better. But I think just in generally, what I talk to about clients are like, okay, what are your goals? Are you wanting to be feeling better as quickly as possible? Or, then we might want to go the medication route. Or are you willing to like kind of take our time and see how we do with the lifestyle changes, the supplements? How severe are your symptoms? Are they like debilitating? Are they making it hard for you to function every day? Then we might want to think about a medication for a little while. Have you done treatments in the past with medication? What is your mental health history? And then really coming down to like talking about the risks and the benefits of meds with the client. I always, though, tend to think it's best to use lifestyle changes as well as like if a patient is wanting to try medications, I encourage them to do like these holistic lifestyle changes because usually I see the best results with that. Um, and so
Yeah.
another thing that I find helpful when it comes to stigma is like, let's compare mental health medications to any other medications that we use to treat a medical condition. Why are mental health medications so different? Because really mental health issues are medical conditions. Because much of the time it's things like genetics or things that are out of our control. It's not a sign of like weakness or failure that you're not trying hard enough, that you're struggling with your mental health. So, like, let's say if someone had cancer, right, and they needed chemo, would we make them feel bad for having to take chemo? No, they would be supported, they would be embraced and have people coming around them. Like, why can't we do that with mental health conditions? I don't see a big difference there. So, yeah,
Yeah,
it's about
absolutely. I
reducing
totally
the
agree.
stigma.
Yeah. And you also mentioned doing more like holistic things in addition to medication. Can you tell me what you use for those outside of just using medications? Like, how do you bring
Yeah.
those together?
Yeah, I'll go through a few of my favorites. So, bright light therapy is actually one that I love. It's very underrated by people. It can be so helpful. They've actually done some studies that have shown it can have similar effects on mood and anxiety, more the mood, to a medication, actually. And you can combine it, you can use the bright light therapy and take medications as well for like an increased effect or increased improvement on your mental health. They've actually done like those functional MRIs that I talked about earlier, and you can see brain changes, positive brain changes after using the bright light therapy. It's also been found to help with like your attention, how well your brain functions, like your cognitive function. So basically what it is, it looks like a tablet and it's just a bright light that you put in front of your vision stream for about 30 minutes a day, usually in the morning. And it needs to be like a certain amount of brightness. So you want to look for one that's 10,000 lux or higher. And you can do it every day. I didn't mention that it also helps with sleep because it's all about getting your brightness during the morning hours and getting into your circadian rhythm. So you can order those online. I do recommend finding one that's been like lab tested to show it's actually has the amount of brightness that they advertise, because that's really important. Yeah. Another one, of course, is exercise. I love that. We should, try and shoot for trying to get 30 minutes of movement in 5 days a week if possible, but I know everyone does different routines. I love strength training, making sure you're getting your steps in, like getting those 10,000 steps a day is so good for mental health. So what we know is that exercise increases our feel-good hormones like serotonin, dopamine, norepinephrine, and that can definitely help with anxiety, depression, PTSD, all of the things. And it just helps you feel better about yourself, I think,
Yeah.
when your body is healthy.
Yeah, for sure.
And then, of course, looking at things like nutrition, like are you eating whole foods, getting enough protein in. I love probiotic foods like Greek yogurt with active cultures in it. The reason why is our gut microbiome is so important for our mental health
Mhm.
because we make about 95% of our serotonin or feel-good hormone in our gut. So by helping our gut health, we can help our brain feel better too. And then the other thing you want to avoid is foods that are really highly processed or have a lot of like sugar in them because it can lead to blood sugar kind of, increases, dips throughout the day, and then that can lead to anxiety or maybe feeling some mood changes, concentration changes throughout the day.
That hangry feeling.
Yeah, exactly. Sleep is, the biggest, well, one of the biggest things, making sure you have you're getting enough sleep first off. And if you're not, like, what can we do to help with that? Like avoiding screens right before bed, bright lights. A big one I see is caffeine,
Yeah.
having a little too much, and then, not being able to fall asleep at night or having it too late in the day. And just working on creating a good sleep routine can be really helpful. If you're someone that really struggles with sleep and you've tried all the things, there's a therapy called cognitive behavioral therapy for insomnia, and that has shown like really, really good results with sleep issues.
Okay. Good to know. Are those specific therapists that offer that? Or,
Yeah, yep. You would need to find a therapist who's trained in that. And
yeah.
you should be able to do that on Psychology Today. I kind of
Oh,
look for that
okay.
modality. So another thing would be supplements. I'm not going to go into all of them because I have a lot that I like, but kind of the main thing I always tell patients is supplements are not FDA regulated, meaning we don't know what's in them. What they say is in them is what's in them unless they've been lab tested. So you want to look for one that is the easiest way to know is if it's USP verified. That means it has been lab tested for
Okay.
quality. And generally, I recommend a vitamin D supplement for pretty much
Mhm.
everyone that can be helpful for mental health. Kind of 1,000 to 2,000 IUs we need here in the Midwest at least. We might need more. And if you think you do, you can get some testing done for that with functional medicine.
Yeah.
Another great one is omega-3s, like fish oil, that has been shown to help with mood. I'm also a big fan of magnesium, can help with sleep for sure. Like if you take that an hour before bed, you can take up to 300, 400 milligrams or even more. So sometimes you just need a little more of it. So it helps with sleep. It can help with mood, anxiety. And then a probiotic would be great as well for the gut health we talked about earlier. So those are kind of my main supplement go-tos, but there's a lot of other good ones too. And then, there's of course therapy, mindfulness techniques, massage, acupuncture, and then progressive muscle relaxation can be really helpful, which is basically like contracting and then relaxing different muscle groups in your body. They've shown can be very, very effective for anxiety.
Yeah, I love that one because especially I feel like if you have a hard time calming your brain down, but you give it like a specific task instead of just saying, "Oh, we're going to meditate." For somebody like me, my brain is hard to shut off. And so like if I can give it a task to be like, squeeze this muscle and then relax and then squeeze this, then I can stay very present longer rather than, monkey brain and it's off to the races. And 20 minutes later, I'm like, what happened? I
Yeah.
thought I was going to
Yeah,
meditate.
yeah. And when you mention that, like so many clients tell me that they have this, where it's hard to meditate because all these things are going on in your brain. And I would say that's normal. And one tip I give with that is just to be like, if you're having those thoughts, be like, hey, thought, you're here. That's okay. That's okay that you're here.
Yeah.
That's normal. But now I'm going to focus on, my breathing or whatever it is. And you might have to do that a bunch of times, but just
Yes.
try not to get like so frustrated by that because it is so normal for that to happen.
I think when I first started like meditating, I just thought that I was a bad meditator. And I was like, I just like can't do this, or, you should be able to sit down and quiet your mind until I learned that that is what meditation is that your mind gets distracted and then you bring it back. And then your mind gets distracted and you bring it back. And I was like, oh, I
Yeah.
missed the whole point of it.
Yeah. Basically, nobody would be good at meditation if we had to
Right.
stop thinking totally.
Yes. I think I got that idea honestly from like listening to podcasts from people who were just like, probably living a very, very intense, mindful life that didn't have the busyness on like what I would say a normal American woman has on her plate. Right. Like it's just very different lifestyles. And so, like, when I would hear other people describe their meditation practice, I was like, I don't get that at all from this. And so I must be doing something wrong. But it's like some people also make it sound a lot different than what it actually is. So just to normalize that that is what meditation is. It is
Yeah,
okay that your brain is going a million miles a minute and your meditation practice actually noticing of that happening is simply what the practice is.
exactly. And it's a
Yeah.
skill just like anything else. It takes time to learn.
Yeah. Yeah, for sure. If somebody's listening today and she's not sure if she's should take it more serious than what she is, or maybe she's downplaying how she feels and she's like, it's not that bad. I can still like do XYZ. It's not impacting my day-to-day life. And she's just kind of like maybe poo-pooing her symptoms and how she feels. What would you want her to know, or what would you tell her?
I would say, listen to what her body is telling her and not doubting her feelings or mental health concerns. A lot of women that come to see me, they feel like what they're experiencing is not bad enough to seek
Mhm.
help. And a lot of times I'm like, this is actually, you've really been suffering. Like, why'd you wait so long to come see me? I don't actually say that, but sometimes I think that in my head of like, gosh, we could have got you feeling better. So I would just say, not question how you're feeling, get help sooner than later. And there's really not a problem that's too small to improve. We deserve to care for ourselves first and foremost. Like that's our most important job. Yes, we have to take care of our family and our kids and all the other things, but we're really the only ones who can take care of us in this way. And you deserve to feel better and really live like the best life that you can.
Yeah. And I'd also say to that too, I think that sometimes women feel like it's not bad enough because they've just so much normalized or they're around people who normalize feeling bad.
Hmm.
And sometimes you just need validation and maybe this podcast will help her feel validated enough to be like, oh, I don't like just because somebody else says that this is a normal way of feeling or to just push through or that type of stigma to it that if you are noticing that you just don't like it, that's enough for you to
Exactly.
be like, let's just find something to make me feel better because it's good to feel good and it's
Exactly.
okay to want to feel good.
Yes, I agree. And
Yeah.
I think at one point in history, like mental health was looked at as like you have to be in crisis,
Mhm.
or be in the hospital to get help. And we want to be more preventative now and really help you earlier, so you can be feeling better.
Yeah, absolutely. Well, I have loved this conversation today. I think it is definitely one that people should listen to and listen to again and again, maybe like once every year as a reminder. Tell people where they can find you and then how they can work with you as well. Do you work with people virtually in addition to in person?
Yep, I
Okay.
work with people virtually or in person. For a virtual appointment, you do have to be located in the state of South Dakota to see
Okay.
me right now. And then the easiest way to reach out is just to go to my website. It's www.bloom, like a flower, mentalhealthwellness.com. And then you'll find there like a contact form, and you can either book a phone call with me. It's a 15-minute complimentary phone call to talk about working together, and ask all of your questions. Or you can do like an inquiry and I'll get back to you. But I think just booking a phone call is the best way to go about it.
Okay, sounds good. And then we'll put that in the show notes as well so people can easily click there. And then do you hang out anywhere specific on social media? I know you have an IG and Instagram
Mhm.
account. Do you hang
Yep.
out anywhere else?
I have Facebook, just Bloom
Okay.
Mental Health, the word
Okay.
and wellness is my Facebook account. I try and provide like some education on there as well. So it's a good place to go just to learn more about mental health.
Okay, very good. We will put that in the show notes as well so people can easily find you. Well, thank you so much for being here today.
Yeah, thank you. It was great.